Today we're going to cover what it might look like to reopen schools during the COVID-19 pandemic. This is a topic where there are a lot of different considerations that need to be taken into account. And at the end of the day, our goal here was to provide an interactive tool that could be used by school administrators and policymakers to help them understand the impact of different mitigation strategies on the outbreak potential within schools. The tool here is a SEIRS epidemiological model that we developed with Carl Bergstrom and Ryan McGee at the University of Washington. This is a mathematical model that looks at viruses like SARS-CoV-2 and models their potential for outbreak within populations like a school. With the model, we are able to look at the impact of different mitigation strategies like student cohorting, proactive testing, and vaccinations of teachers to understand how those mitigation strategies might help reduce outbreak potential within schools. We also looked at the impact of things like community prevalence for COVID-19 cases, as well as the existence of novel, more transmissive strains of COVID-19 like B.1.1.7 and how that might affect the outbreak potential within the school population. At the end of the day, we built two different models, a primary school model and a secondary school model. The primary school model is meant for elementary schools, so that these are children under the age of 10, who we know are less susceptible in general to SARS-CoV-2 infection as compared to adults. And we also know that they're less likely to be symptomatic if they do become infected with SARS-CoV-2. And that was built into the primary school model as a parameter. In addition, the network structure of a primary school is organized such that you have teachers that are assigned to groups of students into classrooms. And these classrooms are more or less stable cohorts throughout the day, where the classrooms mostly stay with themselves. The teacher and the students mostly stay together, and there's not much intermingling between classrooms. In contrast, when you look at the secondary school model, we know here that there are children over the age of 10. These are adolescents that are preteens or teens. And we know that these individuals are more like adults when it comes to their susceptibility for SARS-CoV-2 infection, as well as their likelihood to show symptoms if they do become infected. So that was built into the secondary school model as a parameter. In addition, the secondary school model has a different network structure. Secondary schools, which are middle schools and high schools, generally have students moving around more throughout the day. You have different classrooms of students who are in different subjects throughout the day, and they interact with different classmates as well as different teachers as they go throughout a single day. And that's built into the network structure of the secondary model. The first thing we looked at then is the impact of student cohorting on the outbreak potential in the primary and secondary school models. Student cohorting is when you take a single student classroom and you break it up into two groups, and you have these two different groups coming into campus on different days or different weeks to reduce the number of students who are on campus at the same time. This alternating student cohorting strategy has been employed by many different schools when they think about reopening, and we wanted to understand how it could affect the outbreak potential in our model. What you can see here is that in both the primary and the secondary school model, student cohorting can very effectively reduce the amount of outbreaks that might occur within the student population across both the primary and secondary school models. What you'll notice here is that weekly cohorting is slightly more effective than daily cohorting. And you'll also see that in general, student cohorting is more effective in the primary school model than in the secondary school model. And this has to do with the fact that primary schools already are in stable cohorts. What you'll also notice is that student cohorting can be very effective in reducing the likelihood of outbreak within the student population, but the teachers are still susceptible to outbreak. And this is because although the students are on an alternating schedule, the teachers are still on campus 5 days a week in order to be able to teach all the students across the cohorts. The next thing we looked at is proactive testing. With proactive testing, what you're doing is testing everybody within a population at a certain frequency to be able to identify individuals who have been infected with SARS-CoV-2 and pull them out of the population before they're able to transmit that infection to anybody else. What we looked at here then is proactive testing of all the teachers and staff, or teachers, staff, and students at a cadence of once or twice weekly. What you can see here is that proactive testing can be very, very effective, and the more frequently you test and the more individuals you test, the more effective it is as a mitigation strategy. What that means then is that if you can test all of your teachers, staff, and students twice weekly across your full population, this is the most effective mitigation strategy as compared to no testing at all. What you'll notice is that when community prevalence is high and there are many new cases being introduced into the school population, proactive testing at a high cadence becomes very important. And in fact, when you look at the secondary school model, you can see that proactive testing is very important, not only in the teachers and staff, but also within students. And at the end of the day, because of the intermingling that happens in a secondary school, as well as the fact that the students are just as susceptible as the teachers, for secondary schools, proactive testing will need to be implemented across teachers and students to be able to really see a dramatic effect in the ability to reduce outbreak potential. At the end of the day, it really depends on what the community prevalence is, but you can also think about combining mitigation strategies like cohorting with proactive testing together and see how that changes the potential for outbreak within the different populations. We also looked at vaccinations. Right now in the United States, we know that teachers are currently prioritized as part of the vaccine rollout. And what that means then is we wanted to understand what it would look like if all the teachers within the model were vaccinated with a 90% effective vaccine, which is very similar to the effectiveness of the Moderna and Pfizer vaccines that have been approved so far in the United States. What you can see here is that by vaccinating teachers, we can greatly protect this particular population, teachers, which are an essential workforce. But what's also quite interesting is if the vaccine turns out to also be able to block transmission of SARS-CoV-2, then the vaccination of teachers not only protects the teacher population, but it can actually also help to protect the student population. This is because by vaccinating the teachers, you're actually pulling out of the population a group of individuals that normally would be able to transmit the virus. And by blocking their ability to transmit the virus, it actually helps to protect the rest of the population, the students, as well. Now, a major caveat here is that right now we really don't know what the effectiveness is of the current vaccines to block SARS-CoV-2 transmission. All the data we've seen so far has been about these vaccines' ability to prevent COVID-19 symptomatic cases, and we don't yet have enough data to understand what their ability is to block SARS-CoV-2 transmission between individuals. However, if we do believe that these vaccines are able to block SARS-CoV-2 transmission, then you can see that this type of vaccination strategy of vaccinating all the teachers can help to not only protect the teachers, but also have a disproportionate effect on the students. The last thing we really looked at is the impact of community prevalence on the outbreak potential within these school populations. What's important to understand here is that if there are many cases of COVID-19 within a community, so if there's a school district with many different cases already happening in the community, then that means that the likelihood that a new case is introduced into your school is higher. And indeed, what will happen is that you will have new cases being introduced into your population at a higher frequency when community prevalence is high. What this means then is you really have to think about how you might layer mitigation strategies together or pursue more aggressive mitigation strategies in order to be able to reduce the likelihood of outbreak even when community prevalence is high. In addition, we looked at the impact of a more transmissive strain of SARS-CoV-2 like B.1.1.7 on the model. What you can see is if a more transmissive strain is introduced, like B.1.1.7, which is known to be 50% more transmissive than other strains of SARS-CoV-2, this does increase the likelihood of outbreak across the population quite drastically. Again, in this case, if a more transmissive strain of SARS-CoV-2 is prevalent within a population, you will need to consider more aggressive mitigation strategies and layering mitigation strategies together to be able to try to bring the outbreak potential of that population down. At the end of the day, there's really no right answer for how exactly to reopen a specific school. And our goal here with this interactive model is to make a tool that allows school administrators and policymakers to come at this problem in a data-driven way and look at how you take all of these mitigation strategies like student cohorting, proactive testing, vaccinating of teachers, and take into account other parameters like community prevalence, transmissive strains, and understand then how you layer all these things together as tools to be able to combat outbreaks as we think about reopening schools during the COVID-19 pandemic.